$6.3 million invested, and the rest is kinda tricky. In this episode of the Subsidyfiles, UnitedHealth Group. UNH is the largest health insurer nationwide by market share, membership, and revenue, and is ranked as a Fortune 5 company based on its revenue. At the end of 2022, UNH disclosed $324 billion in revenue, with a gross profit of $141.5 billion and a net income of $20 billion per macrotrends.net. Their federal corporate income tax rate came in at 20.5%. Although UNH appears to have favorable customer ratings, its insurance plan options call for ophthalmologist invention. Of course, individual plans vary in cost, so your mileage may vary just as well. UNH has 215 subsidiaries, which is where it gets tricky, including OptumRx and Optum Care, which create a circular healthcare system. OptumRx, for instance, owns compounding pharmacies in Optum Care, which they call a family of 60,000 doctors and 2,000 clinical locations nationwide, creates an enormous imbalance in the healthcare marketplace. In all, UNH spent $6.3 million on lobbying, was represented by 9 lobbying firms and 45 individual lobbyists. Their influence focused on 5 government agencies, 16 bills, and mostly raised issues with H.R. 5376, the Inflation Reduction Act, and H.R. 3173, Seniors' Timely Access to Care Act. UNH lobbying influence was less about funding, but about finding pathways to creating a circular healthcare system poised to monopolize healthcare, effectively leaving Americans with far fewer options. Did UNH get money? Yes, but it's marginal. $37.5 million in loans and $93 million in federal, state, and local subsidies, which pales in comparison to their net income. Moving on to compensation. Although the stewardship of UNH leaves some to be desired, as is evidenced by the graphic, the assessed penalties, of course, are staggering. CEO Andrew Whitty received $19 million in compensation at a ratio of 348 to 1 compared to the median worker's income of $54,000. The sum of UNH's game plan is fiscally low-key, but from a perspective of monopolized stranglehold, it's actually quite significant. They invested $6.3 million in lobbying and PACs, but rather than getting billions in subsidies or loans, they pathed a way to continue acquisitions, seemingly having a good word in with the regulators. Meanwhile, Americans are paying horrendous premiums and debilitating copays.